Welcome back to another episode of Mind Your Rehab. I'm Dr. Allison, and this is...
Dr. Vinny.
Hello!
Hi.
I excited Baloo when I said hello like that.
Yeah, that makes sense.
So, it's a new week. It's a new day. It's a new something.
Okay.
I am 3.5 weeks out from my show.
How you feeling?
My Broadway show.
The one that you were just singing about, right?
Yeah.
Yeah.
I am feeling... I could feel better. I just feel not the most prepared. I don't think my coach listens to this, but I hired a posing coach. If she does listen to this, I hired a posing coach. I'll tell you about it later this week.
I'm sorry, I just can't stop this visual in my head of you doing a Linda Belcher style one-woman show on Broadway now. It's all I can think about because you said that. Okay.
Thank you for loving me.
I got it out of my system.
Thank you. So yeah, working with a posing coach is definitely helpful, but also it's wow, wish I did that sooner because I don't feel the most prepared. But also, this is my first time, so you don't know what you don't know, and you live and you learn.
Yeah,
and
you're learning.
All the cliche things that are true.
Yep.
So, I'm really not great at getting my lats to do anything. So, I booked a deep tissue massage as per my coach's request. So, that should help. That's not happening until next week, though, so that'll be 2 weeks out.
So you'll get to hear about it again next week.
Actually, no, next week I will not have had it yet, unless he can move me up earlier.
Oh, okay.
So there's that. I am officially below 2,000 calories. I'm at 18-something. Definitely feeling that in my workouts. Definitely starting to feel hungry. Also, cardio has went up again, so, lots of discomfort.
You're really in the thick of it.
I am in the thick of it, but I just keep telling myself it is temporary. Today, I found a Werther's original in my backpack the other day, and today I looked at it and I was like, I bet you this will have way more calories than you'd expect, and yes.
How many calories are in a Werther's original?
Well, I think it goes by 3 pieces,
okay.
And one piece is 8 grams of carbs.
1 piece is 8 grams of carbs.
Yeah.
So 3 pieces is 24 grams of carbs?
Something like that.
Wow.
Wait, 1 piece I think is actually, no. 1 piece is, I think I had it in my phone as 2 pieces, as 0.66 of a serving, because that would be 2 pieces.
Got it.
That was 8. So it would be 4.3 grams of carbs, and I'm really not willing to give those up.
That makes sense that you're not willing to give those up.
Yeah, I'd rather have a strawberry, couple of strawberries. You can have a handful of strawberries, and that would be equivalent and more filling than a Werther's original. So I'm saving that.
Man, now you know. That's crazy.
Yeah,
I wouldn't have thought that.
And then yesterday, I forgot a towel when I went to the gym. Keep fucking up gym prep. I forgot a towel, and the gods were with me, because when I went to go shower, there was a roll of paper towels not in the dispenser. It was just there. It was all the lights of the heavens were shining on it. So, yeah, I brought those paper towels into the shower and dried myself off like that.
Nice. Finding out ways to make it happen.
Yeah, but that was it was the universe was we'll do this one time.
Remember your towel.
Fucking remember your towel.
Moving forward.
I think that's it for the bodybuilding updates.
Nice.
I'm leaning out.
You were definitely leaning out. Yeah, you're doing a great job.
Thank you.
It's really impressive to see.
Thanks.
Yeah.
Enough about me.
Enough about you. What else is going on? Not a whole lot.
No,
Not a
we
whole
had
lot,
the
really.
4th of July. We had a crazy storm cell that moved through here and destroyed everything.
We had...
I shouldn't say that.
There was a nice alert on my phone. Imminent danger alert, 80-mile-an-hour winds, which I haven't seen before.
It was stay away from the windows.
Yeah. It said specifically, like, get to the basement if you can, stay away from windows.
Yeah.
And luckily, we didn't have any issues personally.
No, our power went out for a second.
It went out a couple of times and kept coming back.
Yeah, main power line went down around the corner from us, hit a house that went on fire for a little bit, and then a bunch of houses behind us lost power for days.
Yeah, we didn't have to deal with anything other than hearing our neighbor's generator running for 3 or 4 days straight.
Yeah, so not so bad.
Not too bad at all.
Bunch of trees.
A lot of tree destruction. Yeah, a lot of. I mean, just driving around, like, PSE&G was doing their job a lot.
Unrelated, when I was driving to my office today and I was getting spit out onto Route 22, which is a horrible road, but when I was getting onto Route 22, there were just plastic bags everywhere.
So much trash.
No, it looked as though it fell out of a truck. Like, there were so many. And everyone was kind of driving slow. I've never seen so many plastic bags in, like, one area. It was crazy. It's terrible. Anyway.
So yeah, that was definitely some excitement. We didn't do anything for the 4th, really. We watched Independence Day.
Of course.
Which I'm going to go out on record and say I would rather watch Independence Day again before Disclosure Day again. We'll say that.
Yeah.
Definitely.
But I also will say that this was maybe my, like, 2nd or 3rd time watching Independence Day, and I always forget how like, actually bad of a movie it is, but it's great.
It's just like a blockbuster movie from, I think it's 96. It's
just like,
yeah.
This isn't a spoiler because it's been around for a million years. It's on you if this is a spoiler for you. But, like, fucking president's wife just, like, all of a sudden she's just, like, internally bleeding, and the doctor comes out and talks to the president, and he's just like, she's internally bleeding, there's nothing we can do, she's going to die. And it's like, she is literally awake in the hospital bed, fine. Like, they didn't even attempt surgery. I don't know how they'd know that.
She was alive.
And the daughter got over it pretty quickly.
President Pullman did his job and told his daughter that she was sleeping, and that was sufficient for the little girl. And but yeah, the mother died in a minute and a half. It was just like, oh, we'll go to see her. Nope, never mind.
She was there. She was in the movie for like 2 seconds. There was like no relationship that the audience could even build with her. That, like, you couldn't really care.
No.
You could not care. They definitely tried. They put a lot of different things into that movie.
It's a 2.5 hour movie.
I know, and they put like 5 stories into it.
Yeah.
So, it was. Yeah.
Totally worth it, though.
It's a great movie. I'm going to watch it every year. I don't care. It's great.
Absolutely worth it.
Yeah.
And then after you fell asleep, I watched Uncle Sam.
Which, I watched.
Which is I think from 1996, weirdly enough.
Uncle Sam is a horror movie. Hilarious.
Mm-hmm. Yeah.
B horror movie.
Yeah. So that was fun. Did my due diligence with 4th of July themed movies.
Yeah.
And then we spent some family time down in South Jersey for
super hot.
For my nephew's 4th birthday. Our nephew's 4th birthday on my side.
Yes, and then
Luca's
we have
on my side.
Our nephew's birthday on my side this coming weekend.
Yeah.
They're 5 days apart.
Yep.
That's really it for the 4th. The dogs were hot.
The dogs were hot,
and
but they didn't.
It's cool.
We were lucky. There were a lot of fireworks going off, and the dogs really didn't react to the fireworks like they have in years past.
Definitely, I put a blanket over Frankie's ears for a little bit, but for the most part, they really I don't know if their hearing is going or if they're just maturing, but it worked out.
Yeah. It was nice. It was nice.
Cool. I think that's it for
updates. Done.
For fun dates, updates, fun updates.
Fun updates are done.
Updates. Can you move closer to me?
How close do you want me to be? Is that better?
Just so we're even in the frame for all the YouTubers there.
Okay.
Now we're very close.
Mm-hmm.
Hello.
Hi.
So today's topic is, I was actually listening to another podcast and it just gave me ideas of oh, right, we should probably tell people about this. And one of those things was being a non-diagnostic clinic, which, not diagnosis-based.
Yeah, not a diagnosis-based clinic.
Yes.
We are diagnostic.
Yes, sorry. So, like, typically when you go to an orthopedist or something like that, they will diagnose a tear, or they'll tell you you have arthritis. They'll just be like, yeah, that you have bad arthritis. Go figure it out. So we take those diagnoses into consideration, but they don't really hold a tremendous amount of weight. The way that I approach an evaluation is like trying to look for, first of all, we've got to rule out red flags, just scary red flags. And those are like I don't even know if I've seen a handful of red flags in my almost 13 years of practicing. You may have, because you worked in a neuro clinic.
Well, I was going to say, not even, I mean, yes, in the neuro clinic I saw them, but I mean, I was in a street level practice in Midtown Manhattan. I saw a bunch of wild shit walk into the office regularly.
Yeah. And were you also in network?
No, we were out of network.
Oh, okay. I don't know. Like, I didn't see crazy stuff. I didn't see crazy stuff in Brooklyn.
I think the street level side of things definitely adds to the insanity.
So yeah, we I don't really see anything that is really red flag. Sorry, Baloo is just making himself very present and shoved himself behind Vinny on the couch. So when I am working with people, I understand their diagnoses that they tell me they have. If they have relevant imaging, then I want to see it. But I am really assessing function and seeing where are they from a standpoint of movement that could give us information, paints a picture about why they're having the pain that they're having. Because even a diagnosis doesn't necessarily dictate your pain. Like, for instance, a very common one, which I already mentioned, is arthritis. Arthritis is a very common diagnosis, and people will come in, they'll talk to me and they'll say, well, I have a lot of arthritis in my knee, so blah, 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 or X, Y, and Z. And I understand that they have arthritis, but it is so not a limiting factor in being able to progress. It is a loss of range of motion, a sedentary lifestyle. It is stress management. It is not lifting ideally, or it's so many other things before it's the arthritis.
Yeah, I think one of the things that happens with people when they go into a clinic that is focused on giving people their diagnoses, right, is like, you're going to walk away with the diagnosis. And then when you walk away with that diagnosis, you typically don't have action steps to take moving forward to address the issue. And also you can start to have an attachment or an identity that surrounds the diagnosis. Like that is a great example. Someone coming in and saying, I have all of this arthritis in my knee. They're not talking to you about how they can't crawl on the ground with their grandkids like they want to be able to, right? Yeah. Or go for a nice long hike. They're just solely focused on the identity of being someone who has bad arthritis.
Right, yeah. And it is... I don't remember.
Allison's back to not remembering things.
So...
She got that prep brain.
Yeah, God. Can you riff? Say something.
Let's see. Well, I mean, we definitely understand diagnoses, and we are, like we said, I think it was last episode where we were talking about differential diagnoses and going through a process. Like, we know what those things are, but that's great for textbooks. That's great for passing an exam.
Well,
it's not necessary. Sometimes it's necessary, depending on the situation, but I don't think it is 100% necessary. If someone has a goal of trying to be more athletic or get out of pain.
Right. So a diagnosis is not individualized. It is like an umbrella of, you have this thing, But 5 people can have that thing and it presents differently. It means something different for them. It has affected them differently. When I'm looking at somebody and evaluating, going through that assessment, I am looking for patterns. How do they move? Because that tells me a lot more. And what are their goals? How has this affected them? Because the overcoming the pain or the injury is not just about like getting out of pain. It's regaining your life and hitting goals that you have. And those differ person to person. Yeah, it's like typically the diagnosis is actually a symptom of something else.
Yeah, I love that. That was one thing that always drove me nuts, is like low back pain is a diagnosis. That doesn't tell you anything.
Yeah.
Low back pain is something that you experience, but like how exciting is it to go to a doctor and them tell you that you have low back pain? You knew that. You didn't need to go to the doctor for that.
Does the doctor say that?
I mean, that's if somebody's really looking for a diagnosis, that could be a diagnosis. That's what I'm talking about. That's the absurdity.
Yeah, it's
of it.
like not everything has to be a textbook label. It's not helpful.
Right. I'm sorry. Lumbago. Or, that's low back pain.
Yeah.
Or cervicalgia, which is neck pain. Like
Yeah.
you don't need those in order to start addressing the issue necessarily.
Yeah. Also, when you get a diagnosis, it is like, okay, for instance, Achilles tendonitis or tendinopathy, whatever. That doesn't account for all of the things that had to happen in order for that to be your diagnosis. Like tendonitis or tendinopathy doesn't just happen. There are movement patterns, there's joint mechanics, there's undertraining, overtraining, there's things like that come into play in order for that to ever get there. And so I hear that you have that. That is the symptom. That's the peak of the iceberg above the surface of the water that we're seeing. What is below the surface of the water that grew to become that? And that is why we're not a diagnosis-based clinic, because it matters, but at the same time, not really. Like, it matters.
It's a piece of the puzzle.
It is the picture of the puzzle on the box, right? And then all the pieces we have to figure out by going through movement to see why did that happen in the first place. And even then, there are still going to be layers that are missed initially and will be uncovered as a treatment plan goes on. Because every session is diagnostic in your abilities and your struggles and things like that. Ultimately, the goal, no matter what the diagnosis is, if you have a rotator cuff tear or you had surgery on your rotator cuff, either way, the goal now has to become, what do we need to do in order to make your shoulder the best functioning that it could possibly be? And a diagnosis of a rotator cuff tear doesn't necessarily get me to that goal. I have to see what is your shoulder, what is your rib cage, what is your scap capable of in order to actually know where our baseline is so that we can get further. If we just started at like rotator cuff tear, I don't really know where I would go with that.
I mean, for me, it poses so many questions too. Because even that in and of itself, it's like, okay, the rotator cuff is not just one thing. It's a multitude of different things.
Right.
So which piece of that entire thing are we talking about?
Yeah.
Right? Sure. We have...
Talk about an umbrella.
Yeah, exactly. It's like, okay, we have the most commonly torn one is a supraspinatus, but maybe it's not that one. I don't know. We got to figure it out.
Yeah.
And then, what led to that happening over time, right?
Yeah, because... Go ahead.
I was going to say, most injuries, most things that happen are not happening in a vacuum, right? Like, if there's like a car accident or something like that, right? Like, sure, that can be the situation. But typically when people are coming to us, that is not the case. This slowly happened over an extended period of time, or, one day it just went and I don't know why it went.
Yeah. That's what I was going to touch on, is like the mechanism of injury, unless it was like acute, immediate, like Vin said, a car accident, or you were playing soccer and somebody like kicked you in the knee. Like, unless it was something in a moment that it happened, then we have to search for the underlying reason of why it happened.
Yeah.
And because we see a lot of people who have been to other providers before, it is very common for people to go through my evaluation process and actually say, wow, this connects so many dots for me. I can understand now why I am having this pain and why I haven't been able to make improvement on it despite all my efforts.
Can you give an example? Is there someone that you can think of that you recently saw where that was the case?
Yeah, I had an evaluation. I can't remember if it was Friday or Monday. I think it was Friday. Yeah. And he had been to a lot of different people. And one of those people, I feel like I might have talked, maybe it wasn't last Friday. It might have been earlier. I might have talked about him. But he went to a neuromuscular, I don't even know what he was called. Not educator, but this guy essentially the patient has really, really tight hips, and he feels very limited by them. And by the time he got to me, he was just telling me how he was like, I don't walk correctly. I don't move well. All of these things, this whole language, this wasn't clearly a diagnosis. This was just another provider had kind of fed into, he's doing all of these things wrong. And he ultimately made this patient feel helpless.
That sucks. And
the person would bring him through a lot of very think about how you're walking type of movements, which is not really sustainable.
Think about how you're breathing. You're breathing right now. Did you know that you're breathing right now? Think about it.
Yeah. So it was, so when we went through the evaluation and I could show him videos of what he was doing, went over his range of motion, and also aside from connecting the dots, because he saw all this, we go through a very thorough report of findings so that way he knows what's going on. The other thing that he took from it is oh, I'm not actually broken.
Isn't that awesome? I'm not as fucked up as I thought.
People will often see their range of because I put objective numbers down just so that helps guide me, and it allows me to show them what I'm seeing. And so a lot of the times people will be like, wow, I'm really fucked up. And I'm like, no, you're really not. Everybody's like this. Yeah. And I'm talking about degrees of range of motion, and people think that they think that when they improve, they should have 40 degrees more range of motion. I'm like, you need 2 degrees more. You'll feel a lot better if you have 2 more degrees available to you. Mm-hmm. But, yeah, I don't know. It happens very frequently where people are working with other providers and not getting the results that they're looking for. They'll maybe feel some improvement, but overall they're pretty much in the same position they were from when they started. And so then when I can point out the why, because we're looking at a very holistic picture that paints a very, very big picture and gives us detail about what's going on, then it provides a lot of clarity about what, and even then, there's a big picture, but there's always low-hanging fruit that will make the biggest impact. No matter what. Even if there's 5 things that we see are limited, there's usually 1 or 2 threads that we can pull on that are going to really help unravel things. And we kind of got off tangent with but the diagnosis thing is like the overarching thing. It's like, I'm not looking at you as a textbook. You're an individual that has your own movements, your own activities, your own stresses,
your own history.
Yes. And so being able to, and when you go to a non-diagnosis based clinic like this, there typically is more emphasis on you understanding why.
Yeah.
Which is very empowering.
There's no gatekeeping with what we do. We want to make sure that you have a clear understanding of what's going on with your own body, because then once you do, number one, it empowers you. But number two, when it comes down to it, you're going to be the one that's off doing the rest of your life. You're not just spending your whole life in the appointment with us, right?
Definitely
so
not.
We can't help you do all the things that you need to do outside of the appointment. And if we can give you that information that helps you understand what's going on and feel more empowered to take care of it on your own, then that's really what we're here for.
Yeah. That's it.
All right, that's it.
We're a non-diagnostic, diagnosis-based clinic. I keep saying
that.
We're a non-diagnosis-based clinic. We look at the root of the problem, the why behind what's going on, so that we can actually make function improve and get your shit to function the best it can function.
That's right.
Yeah. Oh, actually, I have a really good example before we leave.
Give it to them.
I have a patient who she broke her shoulder, and and she is a triathlete. And she loves swimming and cycling, and it caused her a lot of pain. She went to PT, and she was just like, she just plateaued and still couldn't do any of these things without pain. And even basic stuff she was struggling with, like picking up her tea. And so I had this conversation with her where I was just like, I don't know, and this is very, I don't know. I don't know how much better your shoulder can get. I'm very honest. I do not know how much better we can get it, but I do know that we can make it the best that we can make it. And it will likely continue to improve beyond the treatment program as long as you continue to work on it. So there was a fracture, extremely limited range of motion and pain. I would say it almost seemed not frozen, but like if you're just thinking about the diagnosis and where she was at, like it would have been only manual care and things like that. But if we're looking at the actual function of these things and looking at her whole body, how the rest of her is impacting her shoulder, and how her weight training is impacting all this stuff, and now she's doing it all. She's now back to riding, no pain. She's swimming, no pain. She's doing everything she wants. She's living her life without pain, and her shoulder is functioning fantastic.
Yeah. I mean, one thing that the diagnosis in and of itself doesn't account for is all the other compensations that you build up around the diagnosis, right? So like you were saying, like if she has an issue on one side where she's limiting where her range of motion is limited, if she's lifting in the gym, she's going to be trying, even as something as simple as a push-up, right? Like she's going to be compensating with the other side to a certain extent.
Yeah.
Whether that's the other shoulder taking on more load or shifting her center of gravity so that she could favor the better shoulder, right? All of these other things happen in real time that a diagnosis in and of itself does not account for.
So all in all, when you get a diagnosis, don't look at it as a limitation.
Yeah, it's not a sentence.
No, not at all.
Not a life sentence.
And the point of this conversation is to allow you to, when you're speaking with a provider, now you may be more aware of the language they use, and you may be able to ask better questions now of like, okay, you're giving me this diagnosis, what should I do? And more often than not, the answer is like, do rehab for it. But like if you're at a PT and they just keep talking about like how you have this herniation or X, Y, and Z, and it doesn't feel like you're being treated as a human, then yeah, like ask.
Then now you know you're not. You're being treated as a diagnosis.
Yeah.
Right? And
yeah.
you are a human if you didn't know that.
Yeah. Maybe you're an alien. I don't know.
That's fine. Some aliens are humans.
What do you mean? What do you mean?
I don't know. What do I mean?
All right. On that note, I'll figure out what he means. Love you. Bye.
Bye.
You're waving.